Hello. So I'm going to talk now about the Republic of Ireland Reimbursement Scheme, which was before known as the Cross Border Initiative Scheme, which is what some of you may know it as, and I think some people still call it that. So this is a picture of the hospital, as you can see there, and as I've said, we are very close to Dublin Airport, and there is underground parking there. So the Sports Surgery Clinic, we are one of the leading private orthopaedic hospitals in the country. We look after all joints and muscles, bones, etc. So from your hips, your knees, your back, your neck, your foot and hand, we cover all those surgeries. The thing I think most people are interested in is the hip and knee replacement. So we do replace those. We do shoulder replacements as well. And we do some ankle replacements, but not as much. Now, the other surgery you may be interested in is the spinal surgery. Now, we do fusions here, but a lot of consultants don't tend to do them on the cross border. But if that's what you are looking for, do come to me separately and talk about that. But we do decompression of the spine and discectomy, and then most hand, foot, and shoulder surgeries. So as I said, we're very close to Dublin Airport, and there is parking here. Now, this is about the scheme, and this is what a lot of people want to know about, is how do they get onto the scheme? Where do they apply to? Now, the one thing to apply for the scheme and to be eligible for the scheme is that you are on a waiting list, an NHS waiting list. And you will need proof of that when you put in your application form. So you will be able to get proof of that from your GP or from the consultant or the hospital that you are on the waiting list with. Now, a lot of people think sometimes that they're on a waiting list and then realize they're only on a waiting list so far to see a consultant and they haven't actually seen a surgeon yet. If that is the case and you're still having to wait another year for that, as well, it's something that we can talk about, ways that you may be able to find a way to get into the waiting list and to see a surgeon rather than waiting longer before the scheme ends. Now, as far as we're aware, the scheme is going to continue till July 2022. Once you have approval on this scheme, you do have 9 months to get your surgery done. So once the approval's in, you can take your time. So what I do say to people is, if you're not sure whether you're going to go on the scheme or not, just put the application form in, because you have 9 months to make up your mind. So we have the phone number there. It's all based in Belfast, and there's the email point. You can go onto their website and download their application form, or you can go onto our website. And as I said, there will be a tab there where you can also download the application form. Takes about 4 to 6 weeks to get approval, and I know they are very busy at the moment, so they are saying give them up to 6 weeks before you hear about approval. So how it works payment wise is you pay it all up front before your surgery. Now, we don't take any money till the day or the week before your surgery, and then once the surgery is done and you're discharged, you get a receipt from us. You hand that in with an application form back into the Belfast office, and you get refunded in about 3 weeks after that. Now, surgery itself, we have a team here of people, and that team involves myself, Glenda Thorne, who's from the finance side, Rebecca Lena, and Margaret Cromwell, and all of us can talk you through your individual cases if needed, and we will supply the phone numbers. There will be another tab, and you can get the phone numbers from this talk. So included, because this is one of the things most people are concerned about, is the price. Included in the price is your hospital stay in a semi-private accommodation, and when I say semi-private, it's that there'll be 2 people in a room. Not always on your own in a room, but there's no more than 2 in a room. Includes your first appointment with the consultant surgeon who's going to operate on you, your pre-assessment, including a cardiac echo if you need it. It includes all your surgeon and anaesthetic fees, your pre and post-operative x-rays, your surgery and your hospital stay, and also 2 post-operative appointments following your surgery. Now, it also includes the COVID swab. So what we are saying to people, though, a lot of people are actually managing to get their swab done closer to home in Northern Ireland, because it does mean another journey down 3 days before surgery to get that swab. So if you do want to get the swab done closer to home, we will take that price off the initial cost. You just need to let Glenda know when you're paying. So what's not included? So any additional consultations with our specialists. So say you go into pre-assessment and they find you have a heart condition, or your bloods aren't right, you know, something's with your liver or your kidneys, you might need to see another consultant to get clearance. Now, if you have somebody at home or closer to you, or you have a consultant that you see all the time, we're happy for them to send a letter down to say that they're happy for you to go ahead with surgery. If it's you don't, and it's somebody here, we have a cardiologist here. Now he can do it sometimes of just a phone review, and that's fine. But you do have to pay an additional fee for those. Any investigation is not part of your normal pre-assessment appointment or to the whole procedure. For some people, it may be extra MRIs or CT scans. It's quite rare, but if you do, they're not included in that package price. Also, what's not included is a private room. If you did want a private room, there would be an extra fee, and Glenda would be able to give you that information. So the surgery itself. Now, a lot of people have heard about us. They may have a surgeon that they would like to go and see, that they've been recommended, and we're happy to pass on those details to that surgeon's secretary. If not, we're happy to help you make that choice. All our surgeons are specialists. They're all on the specialist register for orthopaedic surgery. Appointments and surgery can be complete between 6 to 8 weeks. I know that a lot of people, it's the other important thing is how long they have to wait. Now, some people would like to have their surgery in 4 months' time after Christmas, around the Christmas holidays, and that's fine as well. And you just let us know, or your surgeon know, and then we'll organise that around that time for you. To save you doing too much traveling, we do book all your appointments with your first appointment with your surgeon on the day of your pre-assessment, and that's much smoother for you. The only time you would really have to come back is if you had to see another consultant, or you were coming down for your COVID swab. Appointments can be made on receipt of you getting approval from the Republic of Ireland Reimbursement Scheme. Now, if the reimbursement scheme is going to take 4 to 6 weeks to get approval, you can pre-book an appointment to coincide with that, but you can't book surgery till you have approval. After surgery, now, a lot of people ask how long will they be in for? So I would say if you're having a knee or a hip replacement, it's 2 to 3 nights. It depends on your surgeon, and it depends on how you're feeling as well. There are local hotels available if you have relatives at this moment in time. We still have no visitors coming in. Now that could change, but at the moment we're still following COVID guidelines. So if you do have a relative that does want to stay, or you're coming very early in the morning and you want to book a hotel, we do have local hotels. Now the Crown Plaza and the Holiday Inn are our nearest hotel, but at the moment they're being used as quarantine, so they're not available, but they may be over the next few months. So we are using also the Carlton Hotel on the Dublin Road, which is 10 minutes away from here. Convalescence, if you need convalescence or any social care packages at home, once you go home, you are still entitled to those under the NHS, but you need to let us know, and try and let us know from the time you come into pre-assessment, just so we have time and we're aware of it, so that can be, you can't pre-book these things, but you can be aware and have everything in place. Physiotherapy, the same. You're entitled to your physiotherapy on discharge within the NHS as well. But for some people, especially knee replacements or ACLs, don't wait too long to get back into the system. If you find you're waiting longer than 10 days, book some private physio as well, just while you're waiting. So these are questions that people ask. Some people ask, do I need insurance? Or they've been told that they may need insurance. So is no insurance that will cover this trip. So there is no health insurance that will just cover this trip, or travel insurance. What happens if there are complications? Now, if there are complications while you're here and it's not related as such to your surgery, maybe a heart problem or a bowel problem, we would probably then have to admit you into one of the public hospitals. Now, that's happened about 2 or 3 times over 12 years. It's very rare, but we have a good relationship with the other hospitals, so we do have that option. Now, as well, people before were worried about whether they were covered on the European scheme, that they had the EI card, which covered them. Now, because of Brexit, you don't anymore, but that there is a global card that would cover you if we admit you to another hospital. Readmission within 30 days, which is related to your surgery, we don't charge anyone that has to come back. And again, it is so rare, but if it, just for peace of mind, that you do know there is no charge within 30 days. Now, there's just a picture of the hospital where it's situated and how you can see how close we are to Dublin Airport there. Now, thank you for joining us tonight. And I will be here to answer questions with you live. And you will get all our phone numbers that you can have if you want to call us on any of these things. Thank you.